Hi, I'm Dr. Singhania from Singhania Clinic, and I'm here to talk to you about childhood asthma, a much maligned or misunderstood condition. So, what is asthma? It's a chronic inflammatory disease. That means it's long term and it causes swelling of the airways. And unfortunately, there is no single test to diagnose asthma. So, how do we make the diagnosis? By history, if there is recurrent or persistent wheezing, if there's allergy and family history of asthma, and of course, clinical response to inhalers. So why does it happen? As you can see from the picture, this is a cross section of the airway tube, the tube in the lungs, and it has a lining and muscles, and the upper one is the normal one. Now the lining of the airway tubes in children who are prone to asthma becomes sensitive and swollen. So when there is an allergy or an infection, the muscle around the tube contracts and the lining starts producing mucus. So the lumen of the tube narrows, and this results in wheezing, coughing, and difficulty in breathing. And by definition, asthma is reversible at that point, and so with treatment, it can be reversed. Why is asthma misdiagnosed? That's because childhood asthma is different from adult asthma, and there are many different types. Many children present with wheeze when they have viral infections, and many of them actually may have only a cough. It's known as cough variant asthma. So you have to be very careful when you make this diagnosis. And what are the causes and triggers in asthma? Mostly it is a genetic predisposition. Usually the child has atopy or allergy, and sometimes infections like RSV bronchiolitis, which occur early in life, can cause lung damage as a result asthma. And what are the common triggers? Any respiratory infection. So any viral infection like rhinovirus can cause an asthmatic attack. Any allergens like dust, pollen, or irritants like tobacco or aerosol sprays. Exercise-induced asthma is well known, especially in adults and older children. And even cold air can trigger asthma. So how does it usually present? It presents often while coughing when the child is laughing, crying, or more at night. The cough becomes so bad that the child vomits. It's known as a petrosoid cough. And then the child has a feeling of tightness and difficulty breathing. Many times even a small flu infection, a viral infection, persists for a long time. So how do we prevent it? First of all, we need to know what the child is allergic to and avoid them. Avoid smoking in and around the house. Avoid things like air fresheners, or remove the dust mites. And of course, give vaccinations, especially to influenza. Now, asthma is not curable but manageable. So it's important to know how to control asthma. In this day and age, asthma is completely controlled and does not cause persistent problems like in the past. Now, there are two kinds of medications. There's the controller medication. This is the medicine which reduces the inflammation or swelling of the lining of the air tube, and it can consist of low-dose steroids which are inhaled, or leukotriene modifiers, and very recently the omalizumab, which reduces the production of the IgE antibodies. Then there is a quick relief medication which reduces the muscle contraction, and this is known as the bronchodilators. In children, you use a spacer, which is shown in the picture, because the child cannot control the inhaler completely. So the treatment includes both the quick relief medication and the controller medication. And you need to maintain PEFR, or the peak expiratory flow rate, and symptoms. So the child, because sometimes when the child stops coughing, it doesn't mean the asthma attack has gone. The child may not have a wheeze, but the child may have a low-grade asthma. And so PEFR is a very important way of knowing whether the child is still having problems or not. So the key points are: asthma is caused by inflammation of the airways followed by intermittent muscle constriction. The symptoms can include wheezing, coughing, and can be from mild to severe. And sometimes a person may have asthma only during the winter spells, or only when the child has an infection. Many of the triggers make these symptoms worse, like infections and allergies, and is treated with inhalers, the quick acting reliever inhalers and the controller or the preventer inhalers, which reduce inflammation. Always Be sure to learn how to use inhalers with a spacer or a nebulizer and ask your doctor on how to use these particular medications. If you're seeking help, please visit our website www.singhaniaclinic.com or call us on the telephone number shown below 04 429 8498. Thank you.